Hello and welcome to this Google Hangout. My name is Brian Casey. I'm editor-in-chief of AmpMini.com, and we are here to discuss the second quarter 2014 numbers of the Medical Imaging Confidence Index. We have with us today Ed Cronin. He is CEO of AHRA, the Association for Medical Imaging Management. We also have with us Christian Reynaud-Dan. He is founder and CEO of the MarketTech Group. And we also have with us Joseph McConey. He is Director of Imaging and Laboratory Services at Boulder Community Hospital in Colorado. Gentlemen, thank you for being with us today.
Hi, Brian.
Good morning.
So today's topic, the Q2 numbers of the 2014 Medical Imaging Confidence Index. And Christian, can you talk a little bit about the index and what exactly it involves?
Absolutely, Brian. Thank you. Well, this is a joint initiative between the AHRA and the MarketTech Group using our ImagePro panel, which is a panel of 600 administrative imaging directors in the hospital. And the idea was to monitor over time, using the same questions, which we'll describe in a moment, the level of confidence of those imaging directors and how this would track according to events, business factors, and other variables that may impact their confidence. So we have several indicators that we track over time, and we provide those results every quarter in partnership with AmpMini.com. So here you could see that we have a cohort of 160, 158 to be exact, imaging managers, administrators, who have responsibility for their P&Ls, for the imaging services across modalities. And the scale of the index goes from 50 to 150. So the neutral point is about 100. Anything above is higher confidence. Anything below is low confidence. And you can see that we have tried to have a good representation, not just by geography, but also by bed size. Representing what the market is. As you know, there's a lot more hospitals in this country under 100 beds than there are above 300. So you can see those percentages reflect reality. So there are a number of questions that create the index. We have several areas. The first one is the ability to grow the volume of imaging, both diagnostic and interventional, every month over the next 3 months. So it's looking forward for the next 3 months. The second area is reimbursement confidence, so whether Medicare will not continue to be reimbursed at the same rate over the next 3 months. And then the third area is I can't see the screen. is the third area I'll get on my own. The operating cost. Internal staff costs, whether those costs will remain constant. So they include both operating expenses and labor. And this is the third area. The next area is access to capital. And this is their confidence to be able to secure budget for their IT and imaging equipment needs. So we do include PACS in this index, not just imaging modalities. And then finally, the ability to continue to grow as a profit center, whether they are optimistic or not, both on the diagnostic side and interventional side. So if we wanted to segregate every component of those questions in the index, we could, but we usually track only those 5 high-level areas over time.
And then there's a single number, the aggregate that kind of
exactly. The overall index is a composite of all those questions. And it turns out that the composite is not very interesting, actually. As you will see, over the years, it's been relatively flat. So those are the regions that are represented in percentage. Again, we try to match density of hospital representation. So this quarter's results are what is on the screen. As usual, the confidence for the Medicare reimbursement is very low. It's been very low over the last 2-3 years. So people are very pessimistic, of course, about reimbursement in general. whether it will be maintained or not. And there's been a lot of reduction of reimbursement over the years, and I'll let my colleagues speak about that later on. On the opposite side, very high confidence about controlling costs, both operational costs and staff costs over time. This may not be good news for salaries of those technologists, but from a business viewpoint, those are controlled. And ability to grow as a profit center has always been fairly high and continues to be high in terms of confidence. So that means it's a valuable business if you look at it from a business line perspective. However, there are some fluctuation you will see, but for this quarter, we see some recovery in the confidence for the ability to grow volume of imaging, and we get a score that is now neutral. Prior quarters, those scores were in the low confidence side. And access to capital is still relatively bad, low confidence, but we will see in a minute that some segment of the market are getting some recovery of confidence in that area.
Okay, very good, very interesting. So let me see if I can grab another chart here that should give you kind of a look, a trend line over where things have been going over the last, boy, it looks like about almost 2 years there.
Right, and actually the index got started, as you know, in late 2010, 2011, so we see only a portion of the trending here. I would like to caution our readers and people who look at the index about the visual effect of those lines. I mean, if you just visually say, oh, it sounds like it's going better, you may not be right, because you have to really look at it in the context of the sample and the statistics. So let me tell you what is really significant this quarter compared to prior quarters. We are looking at for an overall improvement in confidence for the diagnostic volume, growth in diagnostic and interventional radiology volume. So that definitely is going back up. That line.
That's the purple line, Christian?
Yes.
That's the lower purple line, I guess. Yeah.
Yeah, that's the first element in the legend. That's the first item on the left,
Okay.
the top left. So this is definitely significant, very significant. The access to capital is somewhat getting better compared to last year, especially December timeframe, and especially very, very true in the mid-size bed range. So the 100 to the 300 bed size definitely have a much higher confidence in their ability to secure capital and budget for this year, looking for in the next 3 months. Something also that's worthy of notice is the smaller bedside segment is also getting much more, have a much higher confidence in general, especially in the ability to grow their volumes. And they were very depressed last year, as you know. But overall, we cannot say overall that across all indicators things are getting better. They're still very pessimistic about Medicare. They're still thinking they do very well in controlling cost and maintain the growth as a profit center. Is about the same. We are not back to the pre-12 recovery scores. I mean, we were back 11 and 12 having a business that was relatively confident overall. We're still below those trending as of today, but there's some elements of recovery, and there's some reasons to be a little bit more optimistic than we were last year.
Well, good. Thank God, because when we talked 6 months ago, right before RSNA, things were pretty gloomy.
It was, yeah.
So Ed and Joe, maybe we could kind of throw things out to you. If you could talk a little bit about what you guys are seeing out there. Is the sentiment that you're seeing in at imaging centers and radiology departments, does it kind of mirror what we're seeing in these charts, in these numbers, or is there a different story out there, Ed?
Well, you know, I think the numbers, as Christian said, if you looked at the trend of each of those lines, you know, over such a short period can really be a little bit misleading. I think the more important thing in looking at all of those trend lines is not how they're moving from left to right, but how they're stacked on top of each other. And the ones that have high confidence are the areas where the managers feel they have some control. They feel they can control their labor and operating costs. They can control somewhat their volume. The things that they can't control, the reimbursement rates, and in some respects the capital availability. They have lower confidence. So really, I think what this is demonstrating, the fact that there is overall confidence at a pretty high level that they'll be able to maintain operations as a profit center, reflects, the need for really a competent manager who's able to do more with less, because I think that's what is still the message that that our members are hearing. That it's
Joe, what?
yeah, go
Thanks,
ahead.
Ed. Joe, what sort of things are you seeing out there in the field?
Well, I would tend to agree with what Ed's saying, that this is actually probably a response to the challenges that we're all facing with lower reimbursements, greater competition and such. And so we've really had to take a harder look at our costs and figure out what we can save on, and really try to lower that part of the equation. I think that the profitability piece of that really tracks that as we're better able to control our costs, we can see our profits at least remain similar to what we've had in the past relative to the cost. With reimbursement going down, if you can lower your costs, then you can still get essentially the same or close to the same profit out of that.
Now, things have been pretty rough in radiology for the last 5 or 6 years. What kind of impact has that had on your department, and what kind of things have you had to do to respond to that?
Well, I'll tell you, some of the things we've had to do is really look at hours of operation and some of the services we've provided. I think in the past we've been probably a little bit more lenient about having longer hours and providing more access, even if the utilization might not have been there. As you're really trying to contain your costs, you start to look even closer at utilization, and sometimes where you can save money is, maybe it's not a 10-hour day at a clinic that's open, maybe it's an 8-hour day, or maybe you're not going to provide certain services if they're being provided by someone else and you're seeing your volumes change. So we're looking at service lines, we're looking at hours of operation, we're also looking a little bit more closely at cross-training, which kind of has come and gone over time, but utilizing cross-training a little bit more to cover more than one modality in times that are slower.
Okay. Are there any specific technologies or services that have you excited? CT lung screening or a PET MR, anything like that? Or are you guys kind of sticking to bread and butter imaging?
I guess I'd say rather than any particular modality, because we're still interested in all of the ones that we have, but what is changing a lot has to do with our pricing structures and how we remain competitive, especially against independent imaging centers that have undercut price over time.
Interesting. Are you seeing any impact from the Affordable Care Act, aka Obamacare? Is that affecting volumes at all?
It is, but very, very little. I think that's going to be a longer-term window. It's certainly out there, and we're seeing some pressures, but at least in the market that I'm at, it hasn't had a huge impact on us yet.
Okay, very good. So as we move, into summer, what sort of things, Christian, Ed, Joe, what sort of things do you think we might be able to expect? Do you think this trend line of optimism is going to continue?
Yeah,
Yeah, go ahead, Ed.
yeah, I would say I would expect it, to continue. I still think there's a lot of uncertainty in the market. What's going to happen with the Affordable Care Act and the elections and all that sort of thing, and I think until we get through this period, that things are, I'd expect most of those lines to stay pretty consistent unless something dramatically changes. I think there'll just be maybe some movement around the edges.
Okay.
What I would say is that what we've seen is that these indicators are early, in what happens in the market. So what I'd like to point out again is the volume are going back up. They're confident that the volume will go up, which means that you will have to invest in throughput, in new modalities, new equipment, or additional equipment, or replacing the one that doesn't have the throughput you're looking for. And that's why there is a high confidence, a higher confidence, not very high compared to absolute terms, but it's getting better in terms of their ability probably to convince CFOs that it's time to renew, it's time to expand and buy equipment. And so I think this is not something that will happen just for 2 months and then this is over. I think it's probably here to stay. And there are other indicators outside this index that tells us that now it's time to be able to be competitive and continue to grow to meet that demand, this new volume.
Good. And Joe, what's on your radar for the next 3 months?
Well, I think I think as Ed said, it's more of a nibble than a big bite. You know, things are changing, but they're changing over time, and so, you know, from a personal standpoint, locally, we are in a process of replacing some equipment and continue to move forward. It's all recognized that we are a profit center, and to do so, we need to stay competitive with the level of our equipment as well. So this has been a very strong first quarter for us also, and we are seeing some reason for optimism, but it's guarded because we know there's many changes on the horizon.
All right, I think that could be the theme for this quarter is guarded optimism, and that's a good thing. So, gentlemen, I'd like to thank you all for being with us today. Christian Reynaud-Dan, Ed Cronin, and Joe McConey, and looking forward to seeing you all on the next installment of the MICI Index.
You're welcome. Thank